Have you ever wondered if something you're doing right now could actually be making a hidden cancer grow faster inside your body? That feeling of dread when you realize a treatment meant to help might be causing harm behind the scenes. I've seen it firsthand with Robert, a 75-year-old who came to my office last year. He'd been taking a common medication for inflammation for nearly a decade. What his doctors never told him was that this exact treatment was potentially feeding his slow-growing prostate cancer, silently accelerating it all those years. By the time we discovered what was happening, the cancer had already advanced significantly. The look of betrayal in his eyes when he realized this still haunts me. The worst part: this could have been completely avoided with information that most healthcare providers simply don't discuss with their senior patients. Today, I'm going to reveal the 3 common treatments that research shows may actually be speeding up silent cancers in seniors over 65. This information could quite literally save your life or the life of someone you love. And the most shocking part, one of these treatments is likely something you've been told repeatedly that you should be taking. So please, stay with me until the end, because what you learn in the next few minutes could be the difference between catching a silent cancer early or discovering it too late. Hey there, thanks so much for joining me today. Before we dive into this critical information, I'd love to know where you're watching from. Drop your city or state in the comments below so I can get to know our community better. If you have any questions as we go through this video, feel free to ask them in the comments section. I make it a point to respond personally to as many as I can. And if you haven't already, please hit that subscribe button and turn on notifications so you never miss potentially life-saving information like what I'm about to share today. Now let's get into these 3 concerning treatments that could be silently accelerating cancer in seniors. I need to pause here and ask you something important before we continue. Have you or a loved one experienced unexplained symptoms while on long-term medications or treatments? Perhaps unusual fatigue that doesn't seem to match the condition being treated, unexpected weight loss, or pain that seems to be increasing rather than decreasing with treatment. You know, many people feel completely alone in this experience, thinking that maybe it's just part of getting older, or that they're imagining things when their body sends these warning signals. I understand how frustrating and frightening it can be when something doesn't feel right, but you can't quite put your finger on what's wrong. This is especially true when doctors dismiss your concerns as just normal aging. If you'd like to share your experience, you can simply copy "My concerning symptom has been" and complete it with your situation. Your insight might help someone else recognize a similar pattern in their own health journey. Remember, your experience matters, and sharing it here creates a supportive community where others can learn and feel less alone in their struggles. Every comment provides valuable perspective that could help someone else advocate better for their health or the health of a loved one. Many seniors today are navigating a complex healthcare system that often treats symptoms without addressing underlying causes. What's particularly alarming is that some commonly prescribed treatments and over-the-counter remedies might actually be compromising your body's natural defense mechanisms against cancer. Today, we're going to explore 3 categories of treatments that recent research suggests could be accelerating silent cancers in seniors. Understanding these risks could be the difference between catching cancer at a treatable stage or discovering it when options are limited. Let's begin with our first concerning treatment category. The first treatment category that may be accelerating silent cancers is long-term use of certain anti-inflammatory medications, particularly non-steroidal anti-inflammatory drugs, NSAIDs, used at high doses for extended periods. Now, I know that many of you rely on these medications for managing chronic pain from conditions like arthritis, and they do provide necessary relief. However, the relationship between these medications and cancer progression is complex and warrants careful consideration, especially if you've been taking them daily for years. What many doctors don't explain is how these medications may influence cancer development through multiple mechanisms. While NSAIDs have shown protective effects against certain cancers, like colorectal cancer, prolonged use at higher doses can potentially promote other cancer types through immune system suppression. You see, our immune system serves as the body's natural cancer surveillance, system, identifying and destroying abnormal cells before they can develop into tumors. When this system is chronically suppressed by medications, cancer cells that would normally be eliminated might instead survive and multiply. A landmark study published in the Journal of Clinical Oncology tracked over 65,000 seniors over a period of 12 years and found that those taking high-dose NSAIDs daily for more than 5 years showed a 35% increase in the risk of certain cancer types, particularly those affecting the kidney, bladder, and even some blood cancers. This doesn't mean you should immediately stop your pain medication, but it does suggest the need for periodic reassessment of long-term use with your healthcare provider. Have you ever wondered why doctors rarely mention these risks during routine appointments? Often it's because the focus is on managing your immediate pain rather than considering long-term consequences. But shouldn't you have all the information to make, truly, informed decisions about your health? The mechanism behind this cancer acceleration is tied to how these medications affect your body's inflammatory response. While inflammation can be harmful, it's also a critical component of your immune system's cancer-fighting arsenal. NSAIDs work by inhibiting enzymes called cyclooxygenases, COX, which produce compounds called prostaglandins that mediate inflammation. However, some prostaglandins also play important roles in regulating cell growth and immune function. By blocking these enzymes, NSAIDs may inadvertently interfere with the body's natural ability to suppress tumor development. For seniors with existing silent cancers, this could potentially remove a crucial brake on cancer progression. What's the practical takeaway here? If you've been taking high-dose anti-inflammatory medications daily for years, consider speaking with your healthcare provider about periodic drug holidays, dosage adjustments, or alternative pain management. Strategies that might include physical therapy, targeted exercises, or even certain anti-inflammatory foods that don't carry the same risks. Remember that the goal isn't necessarily to eliminate these medications entirely, but rather to find the minimum effective dose and supplement with other approaches that don't potentially compromise your immune function. Have you noticed any unexpected health changes since starting long-term anti-inflammatory treatment? Changes in urinary habits, unexplained fatigue, or unusual bleeding might warrant further investigation, especially if you fall into a high-risk category for certain cancers. Many seniors I've worked with were able to reduce their dependence on these medications by implementing comprehensive pain management strategies that address the root causes of their discomfort rather than just masking the symptoms. Always remember that while these medications serve an important purpose in managing quality of life, they're most safely used as part of a broader strategy rather than as the sole approach to pain management, particularly when used over many years. The second concerning treatment category involves hormone replacement therapies and certain hormone-modulating medications that are commonly prescribed to seniors. While these treatments can significantly improve quality of life for many, their relationship with cancer progression deserves careful scrutiny. Hormone therapies affect numerous bodily systems and can influence how existing cancer cells behave, potentially accelerating the growth of hormone-sensitive tumors that might otherwise remain dormant for years or even decades. For women, traditional hormone replacement therapy, HRT, using combination estrogen and progestin, has been associated with increased breast cancer risk, particularly with long-term use. The Women's Health Initiative study, one of the largest clinical trials ever conducted, found that after just 5.6 years of combination HRT, women experienced a 24% increase in breast cancer risk. What's less commonly discussed is how these hormones might affect existing silent breast cancer cells. Estrogen can act as fuel for certain breast cancer types, potentially accelerating the growth of microscopic tumors that would have otherwise remained dormant. For men, certain testosterone replacement therapies carry similar concerns regarding prostate cancer. While the relationship is complex and still being studied, there's evidence suggesting that testosterone might accelerate the growth of existing prostate cancer cells, even if it doesn't necessarily cause cancer initially. A study published in the New England Journal of Medicine found that men over 65 receiving testosterone therapy showed increased growth of prostate tissue, raising concerns about its effects on silent prostate cancers. Perhaps the most troubling aspect of hormone treatments is that many seniors aren't adequately informed about these potential risks or monitored appropriately while on therapy. Have you ever had a doctor thoroughly discuss both the benefits and potential cancer risks of hormone therapy before prescribing it? Many patients I've spoken with were surprised to learn that the comprehensive cancer screening they expected was never actually performed before starting treatment. The challenge with hormone therapies is balancing their significant quality of life benefits against potential long-term risks. For women experiencing severe menopausal symptoms or men dealing with significant symptoms of low testosterone, these therapies can be transformative. The key is appropriate screening before initiation of therapy and regular monitoring thereafter. If you're currently using hormone replacement therapy, consider asking your doctor about the most current cancer screening recommendations for someone with your specific risk factors and treatment regimen. Modern approaches to hormone therapy now tend to favor the lowest effective dose for the shortest necessary duration rather than indefinite treatment. Additionally, bioidentical hormones administered locally rather than systemically may present fewer risks for certain individuals, though research is still evolving in this area. For those concerned about cancer risks but still needing symptom relief, various non-hormonal approaches exist, from specific dietary adjustments to targeted supplements and lifestyle modifications that can help manage symptoms without potentially feeding existing cancer cells. Have you considered getting a comprehensive cancer screening if you've been on hormone therapy for several years? Many silent cancers can be detected through appropriate testing before they become symptomatic. Remember that what worked for your body at 55 may need reconsideration at 65 or 75, as your cancer risk profile changes with age. Regular reassessment of the risk-benefit equation is essential for all long-term treatments, but particularly for those with potential cancer implications like hormone therapies. Don't hesitate to seek a second opinion if you're concerned about your current treatment approach, especially if you have family history of hormone-sensitive cancers or other risk factors that might make these treatments particularly concerning in your specific case. The third treatment category that may be accelerating silent cancers involves certain immunosuppressive medications commonly prescribed for autoimmune conditions and after organ transplants. As we age, our immune system naturally becomes less efficient at identifying and eliminating cancer cells, a process called immunosenescence. When immunosuppressive medications are added to this already compromised system, the body's ability to fight early-stage cancers can be significantly reduced, potentially allowing dormant cancer cells to grow unchecked. Medications like corticosteroids, such as prednisone, methotrexate, and biological agents that target specific immune pathways have revolutionized the treatment of conditions like rheumatoid arthritis, psoriasis, inflammatory bowel disease, and have made organ transplantation successful. However, long-term use of these medications, particularly in seniors, comes with documented cancer risks that often aren't thoroughly discussed during treatment initiation. A comprehensive study published in JAMA Oncology found that seniors taking immunosuppressive drugs for autoimmune conditions had up to a 60% increased risk of developing certain cancers compared to age-matched controls not on these medications. The risk was particularly pronounced for skin cancers, lymphomas, and certain solid tumors. The mechanism is relatively straightforward. These medications intentionally dampen the immune response that would normally eliminate abnormal cells before they can develop into cancers. For seniors who may already have microscopic cancer cells present, this immunosuppression can potentially remove a crucial barrier to cancer progression. Have you ever wondered why transplant recipients undergo such rigorous cancer screening? It's precisely because the immunosuppression necessary to prevent organ rejection significantly increases cancer risk. Yet many seniors taking similar medications for autoimmune conditions receive much less comprehensive monitoring. The relationship between immunosuppression and cancer is dose-dependent and duration-dependent, meaning higher doses and longer treatment periods generally correlate with greater cancer risk. This doesn't mean these medications should be avoided entirely, as untreated severe autoimmune conditions carry their own significant health risks and can drastically reduce quality of life. However, it does suggest the need for personalized risk assessment and tailored monitoring for each individual. If you're currently taking immunosuppressive medications, consider discussing a cancer surveillance plan with your doctor that takes into account your specific risk factors, medication regimen, and duration of treatment. For those on long-term corticosteroids like prednisone, exploring steroid-sparing alternatives when possible might reduce cancer risk while still managing the underlying condition effectively. Modern approaches to autoimmune disease management often employ a targeted strategy that aims to use the minimum effective dose for the shortest necessary duration, rather than indefinite treatment at higher doses. Additionally, certain lifestyle modifications may help optimize immune function, even while on these medications. Adequate vitamin D levels, regular moderate exercise, sufficient sleep, stress management, and a diet rich in antioxidants may all support immune surveillance capabilities despite medication effects. Have you noticed any unusual skin changes, unexplained lymph node swelling, or persistent symptoms while on immunosuppressive therapy? These could warrant further investigation, as early detection remains one of our best tools against cancer progression. For seniors taking these medications, skin cancer screening should be particularly thorough and regular, as these are among the most common malignancies associated with immunosuppression. Remember that the goal isn't to create fear around necessary treatments, but rather to ensure appropriate monitoring and risk mitigation strategies are in place. Many patients I've worked with have successfully managed their autoimmune conditions while implementing comprehensive cancer surveillance programs that helped identify issues at their earliest, most treatable stages. Now that we've discussed these three treatment categories that may accelerate silent cancers, let's talk about practical steps you can take to protect yourself while still addressing your health needs. First and foremost, never discontinue any prescribed medication without consulting your healthcare provider. Abrupt cessation of many of these treatments can lead to serious health consequences. Instead, schedule a comprehensive medication review with your doctor, specifically focused on cancer risk assessment. Bring a written list of questions addressing your concerns, and don't hesitate to ask about the latest research regarding your specific medications and cancer risk. Consider requesting appropriate cancer screening based on your medication regimen, age, family history, and personal risk factors. For those on long-term NSAIDs, this might include kidney and bladder function tests and careful attention to urinary symptoms. For hormone therapy users, comprehensive breast, prostate, or reproductive system screening may be appropriate. Those on immunosuppressants should be particularly vigilant about skin changes and lymph node swelling, with regular professional skin examinations. Remember that cancer risk exists on a spectrum, and many factors beyond medication use contribute to your overall risk profile. Genetic factors, lifetime exposure to environmental toxins, previous cancer history, and lifestyle all play significant roles. This means that medication adjustments should be considered as just one part of a comprehensive cancer prevention strategy. Explore integrative approaches that might allow for lower doses of concerning medications. For inflammatory conditions, anti-inflammatory dietary patterns like the Mediterranean diet, appropriate supplements like omega-3 fatty acids or turmeric after checking for medication interactions, and mind-body practices like meditation or Tai Chi might help manage symptoms with potentially fewer side effects. For hormone-related symptoms, phytoestrogen-containing foods, specific herbal preparations under proper guidance, and lifestyle adjustments might provide relief without the same cancer concerns as traditional hormone replacement. For autoimmune conditions, working with practitioners knowledgeable in both conventional and complementary approaches may help identify the minimum effective dose of immunosuppression needed, supplemented with supportive therapies that don't compromise immune surveillance. Stay informed about evolving research regarding your specific medications and condition. Medical understanding of these complex relationships continues to develop, and treatment recommendations change accordingly. Consider joining patient advocacy groups related to your condition, as these organizations often provide up-to-date information about both conventional and alternative management strategies. Remember that the goal isn't to create fear or anxiety about necessary treatments, but rather to ensure you're making fully informed decisions about your health care. Many patients find that a balanced approach that acknowledges both the benefits and potential risks of these medications leads to the best outcomes and greatest peace of mind. Have you taken the time to learn about all the potential effects of your medications, both positive and negative? Knowledge truly is power when it comes to navigating health decisions, particularly as we age and our risk profiles change. One final thought to consider: our body's needs and vulnerabilities change as we age, meaning that a medication that was perfectly appropriate at one stage of life may need reconsideration later. Regular reassessment of your treatment plan with a focus on changing risk-benefit calculations is one of the most important aspects of proactive senior healthcare. Before we wrap up today's discussion, I want to emphasize that this information isn't meant to frighten you or make you doubt necessary medical care. Rather, it's about empowering you with knowledge that can help you partner more effectively with your healthcare providers to make the best decisions for your unique situation. The three treatment categories we've discussed, anti-inflammatory medications, hormone therapies, and immunosuppressive drugs, all serve vital purposes in managing serious health conditions. The key is ensuring appropriate monitoring and risk mitigation strategies accompany their use, particularly for seniors who may be more vulnerable to their cancer-accelerating potential. Remember that medical science is constantly evolving, and what we understand today about these treatments may continue to develop as more research emerges. This is why staying engaged with your healthcare team and being your own advocate is so crucial. If you found this information valuable, please take a moment to like this video and share it with friends or family members who might benefit. Your simple action could help someone else gain the knowledge they need to better protect their health. I'd also love to hear about your experiences or questions in the comments section below. Has this information changed how you think about any treatments you're currently receiving? Do you have success stories about working with your doctor to find safer alternatives? And if you haven't already, please subscribe to our channel and turn on notifications so you never miss crucial health information like this. We're committed to bringing you content that helps you navigate the complex world of senior healthcare with confidence and clarity. Remember, you are your own best advocate. Trust your instincts when something doesn't feel right with your treatment, seek second opinions when necessary, and never stop asking questions. Your health journey is unique, and you deserve care that honors both your immediate needs and your long-term well-being. Together, we can ensure that the treatments meant to help don't inadvertently cause harm. Thank you for your time and attention today. Until next time, be well, stay informed, and remember that knowledge is your most powerful medicine.